Hi guys, Dr. Caleb McLaughlin here again, and welcome to another episode of Your Endocrinologist in You. Now, I do hope that my first video was quite interactive, and the knowledge that you may have gained from that you have incorporated into your lives, or you may have dispersed such information to your friends and relatives. Now, initially, in the first video, I may have mentioned that in this video, I will be dealing with prediabetes and diabetes. However, owing to the fact that these are two quite extensive topics, I decided in this video to deal with prediabetes, and the next video we'll be dealing with diabetes. Now, what is prediabetes? Prediabetes is when your blood sugar is high, but not high enough for you to be diagnosed with type 2 diabetes. Now, prediabetes is a term that has not been accepted, or it's not a diagnosis that has been accepted as yet by the World Health Organization. However, the American Diabetic Association has already incorporated it into their management of diabetes, or part of what they use as a risk score for persons who may develop full-blown diabetes. Prediabetes may be, you may hear people using terms like impaired fasting glucose, impaired glucose tolerance test, borderline diabetes, non-diabetic hyperglycemia. Just know that these terms are the same. They're one and the same. It's just different terms being used to describe the same thing. The next question should be, who should receive screening for prediabetes, or who are at risk for prediabetes? What are the risk factors of prediabetes? Now, this is very simple. This is a topic that has been discussed at an international level, and we've came up with the following consensus. First and foremost, if you're older than 45 years old, you should be screened at least once every 3 years for prediabetes. Secondly, if you have one or more of the following risk factors that I will list, then you should be screened at least once yearly for prediabetes. First and foremost of these risk factors is if you have a body mass index of 25 or more. Now, the common man may not know what I'm talking about there. All right, but what you can do, you can go to any one of your health posts if you're in the interior anywhere, or you can go to a health center, or you can go to the hospital, or any health professional in your neighborhood can help you with a simple scale and a tape measure to basically assist you in calculating your body mass index. All right. Now, what can influence that? If you have something you call central fat, central obesity, or abdominal obesity, that your abdomen, your belly is increased, like what we say in Ghana, you have bare belly. All right. That will reduce that number. So instead of using a body mass index of 25, that can go down to 23. You're already at risk. All right. Secondly, if you have a first-degree relative with diabetes. Who are first-degree relatives? First-degree relatives can be your parents, can be your kids, or can be your brother or your sister. Any one of your siblings are considered also first-degree relatives. All right. So if you have somebody who have been diagnosed with type 2 diabetes in that circle there, you're also at risk. If you have an obstetric history of gestational diabetes or diabetes during pregnancy, or you have given birth to a child who may have weighed more than 4 kgs or 9 pounds, you're also at risk for that. If you have a personal history of hypertension, you're also at risk for the gestational diabetes. If you have your triglyceride more than 150 mg per dl, or you have your something you call your HDL, which is a type of cholesterol, less than 35 mg per dl, you're also at risk. If you have any signs of insulin resistance, you're also at risk. What are signs of insulin resistance? Most persons may have heard of polycystic ovarian disease. That is a sign of that. Another sign of insulin resistance is something called acanthosis nigricans. What is acanthosis nigricans? This is basically what we call, like every so often we Guyanese see the back of a person's neck is black, like have a thick scaly darkness at the back there. You say, man, you don't cover the back of your neck. That is a sign of insulin resistance. Another risk factor is if you are less than 50 years old and you may have been diagnosed with any heart problem, you're also at risk. If over the last couple of years you have had a glucose tolerance test being altered or is being impaired, or there's alteration, or you have some, like the doctor said to you, you know what, you did a glucose tolerance test and it was abnormal, you're also at risk. So if you have, like I said, one or more of these risk factors, you need to go to your nearest health post, health center, and have your blood sugar tested. All right. Now, these values that I've been giving you there, these are for adults. In kids, there's a bit of a variance there, but the main thing that we should observe in kids, especially if you're over the age of 10 years old, you should check and see if that child is overweight. If that child is overweight, that child should also be screened for prediabetes. Now, you may not know that child is overweight, but what you can do again, there's always an health center in all of our neighborhoods or in an health post. You can go and have them being screened. All right? Now, kids also with signs of insulin resistance, like I may have mentioned, these are kids and adolescents, kids and adolescents, right? You can also have them take a screening also, all right? Another thing that is a risk factor for kids and adolescents is if they have also first and second degree relatives. For the kids, it's a bit more in depth. Remember when I said with the adults, just first degree relatives? If the kids, if they have grandparents or they have some cousin, you need to also. Okay guys, the next question is, what are the signs and symptoms of prediabetes? This is a question that many persons may have inboxed me and asked me after my last video. Now, this is something that has been discussed at an international level, and we've come to the consensus also, of course, that it's asymptomatic. Asymptomatic means that there's no clinical manifestation, there's no signs and symptoms of prediabetes. A few persons or a few literature I have read mentioned fatigue and tiredness, but they have all been thrown out because there is no physiopathology or pathophysiology that has been basically linked towards prediabetes, as in any clinical manifestation as it relates to that. So you can have it and you have no signs and symptoms. The next question that I will be dealing with here now is, how do you diagnose it? To diagnose prediabetes, it's very simple also. But before you go to do the test that the doctor may send you to do, is that you need to fast. Fasting entails you not eating anything for 8 to 12 hours. You can drink water, but don't overdo it. All right. You cannot chew gum. That means you cannot chew your way into fresh, because the lab tech taking too long to take out your blood. You cannot go and chew your way into fresh. You can't go and smoke. You can't drink alcohol, because all of these habits, these bad habits that we have, can give us a false positive or a false negative, and we don't want that. All right. So after fasting, you go. You do the test, they'll take the blood. Now the results can be interpreted in the following ways. There are three possibilities. There are three tests that any one of these three tests come back positive in 2 occasions is enough to diagnose you with prediabetes. The first one is if you do a fasting blood sugar and it comes back from 100 milligrams per DL to 125 mg per DL. This is already diagnosed. This is already diagnostic of prediabetes. All right. If you have that in 2 occasions, you're already diagnosed there with prediabetes. Secondly, if you have an altered or impaired glucose tolerance test, or that is to say that you have values of 140 mg per DL to 199 mg per DL. That is also one of the criteria for you to be diagnosed with prediabetes. These tests, like I said, all of these you have to do them on 2 different occasions, 2 different days. All right, not on the same day. All right. The next one that is still being discussed because of a bit of, I don't know. They are still having a bit of doubt about putting this as part of the diagnostic criterion, because the European Diabetes Association is saying no, then the Americans are saying yes, but it is forming part of the screening process for the Caribbean and Latin America. All right, that is if you have a glycate hemoglobin or your HbA1c between 5.7 to 6.4%. That also is, in two different occasions, diagnostic of prediabetes. All right, so there we have the three criterias. Any one of them come back positive in two separate occasions, you can use them as diagnostic criteria. All right, guys. So let's say now you're diagnosed with prediabetes. How can we avoid the progression of prediabetes to full-blown diabetes? How can we prevent this? All right. Now I'm going to mention some recommendations here. When I actually list them, I need you to take them into consideration, because if a healthy person, a person who is not even at risk, should follow these simple recommendations, they will reduce their risk of them developing prediabetes. If they're pre-diabetic, reduce the risk of them actually becoming full-blown diabetics. So it works with those persons who are at risk, who are not at risk, and who are already pre-diabetics. All right, the first thing I'm going to mention here is weight. Losing 5% of your body weight for persons who have central obesity or persons who are overweight. Losing 5% of that body weight can actually reduce your risk significantly. Let's say you weigh 200 pounds. Just losing 10 pounds reduces your risk significantly. Secondly, your diet. We as Guyanese, we have very bad diet habits. You know what I'm saying, right? We ever so often like to eat our white bread, whether it be from Bakewell or Humphreys, instead of us using whole wheat bread, which is better, which is what you who is at risk or already is a pre-diabetic should be using. You should avoid using refined sugar. You should avoid using sweetened drinks, sweetened tea, sweetened coffee. Avoid all of these refined sugars. Avoid processed meat, like what we like eating this corned beef. We ever so often like eating our corned beef. We need to avoid this. We need to avoid red meat. All of these diet habits we need to change. But what I will do, all right, what I will do after this video, I will try and upload some of the recommended diet plans that you should use. However, every diet plan should be individualized based on a person's financial status, based on a person's level of education, based on where you're living, and all of these things. But very simple things we can do is simply start eating more fruits, start eating more vegetables, incorporate more yogurt into our diet, and as I mentioned before, our whole wheat bread and whole wheat products. All right, try our best to stay away from these chicken skin, chicken fat. These are some of the things that we can basically do, basic things that we as Guyanese we can do, and we can advise each other. All right. Another thing that we need to, another recommendation that can actually reduce your risk significantly for the progression of this said disease is actually becoming more active, exercise. Become more active and mean that you gotta go and join the gym or you gotta go and find a new sport. No, simple things you can do, simple modifications. I'll also list on my page some of the things you can do. Let me mention a few. Instead of you sitting on the phone and talking, you can stand up and talk. You know, in the afternoon, at least three to 5 times a week, you can go and take a brisk walk for 30 minutes. But before you do all these things, you need to also consult with your doctor. I'm making these general recommendations, provided that you don't have a heart condition or any limitations towards doing this. All right, I'm not saying because Dr. Caleb said I should exercise and you got end-stage heart failure, you're going next. No. All right, if you don't have anything based on the doctor's recommendation, you can follow these simple recommendations. Now, diet plans, we have the Mediterranean diet plan. It's very good. It's very effective. All right, I'll make a list of what that entails on my page by tomorrow or a few days from now. You can also use the Nordic diet. I'll list that also what it entails. But all these diets are very low in fat, and they're very much low in refined sugar, low in carbohydrates. All right. So I do hope that this video was of some help to you. But as we progress, I will improve the quality of how I edit my video. Just know I'm not a specialist in this. I'm just presenting my case here. I don't know how to edit videos, so try bear with me if you're not getting all the information clear or all the graphics that you may need. But as time progresses, we will better that. All right, guys, so thanks for being with me, and do have a great day. I hope the 25th of next month I will be seeing you again, and I do hope that you will be dispersing this information to your family and friends. You will be talking to your kids. You will be, try to get the message out there. And again, don't be afraid. Go to your health post. If you have one of these risk factors, go to your health center, because as we progress in these presentations, you will see why you need to do that. Diabetes is one of the leading causes of kidney failure, of blindness, of stroke. So we need to basically attack this as soon as possible before it can progress. All right, do have a great day, and do join me for my next episode on the 25th of next month. Bye.